Welcome to The Explainer. Today, we're going to open up the toolbox for managing ADHD. And let me tell you, this toolbox, it's getting bigger and way more diverse every single year.
So, you might be asking, what are the real options here? Beyond the usual prescription pad. We're going to dive deep into this huge and, yes, sometimes kind of confusing world of substances that may help with ADHD symptoms. We're talking everything from vitamins and herbs, all the way to some really cutting-edge stuff.
Okay, so to make sense of all this, let's think of it as an expanding toolbox. One that's just filled with all these different tools for all kinds of different needs. We're going to organize dozens of these compounds into, let's say, 4 distinct trays inside that one big toolbox.
All right, here's our game plan. First, we'll hit the medical toolbox. Then, we'll look at nutritional support systems. After that, it's a trip to nature's pharmacy. And finally, we'll wrap up with the cognitive frontier. Ready? Okay, let's get into it.
First up, the medical toolbox. This is really the foundation of treatment. And honestly, these are the power tools. We're talking about the FDA-approved, commonly prescribed medications that are the absolute bedrock of how we approach ADHD today.
So right off the bat, these medications basically fall into 2 main camps, and they have really different approaches. On one side, you have the stimulants. Think of them like hitting the gas pedal. They directly boost key brain chemicals dopamine and norepinephrine, and they work fast. On the other side, you have the non-stimulants. These take a totally different route. They kind of modulate neurotransmitters more subtly, and it's a much slower, more gradual process.
Now, stimulants are called the first-line power tools for a reason. They're the most common, and for a lot of people, the most effective treatments out there. They work super quickly to ramp up those brain chemicals responsible for focus. Ritalin and Adderall are the big names, of course. But Vyvanse is actually pretty clever. It's what's called a prodrug. It basically means your body has to do a little work to convert it into its active form. What that does is it gives you a much smoother effect and, really importantly, it makes it less prone to abuse.
But look, stimulants aren't a perfect fit for everybody, right? For people who don't respond well, or maybe the side effects are just too much, there's this whole other group of non-stimulants and even off-label drugs. And it's a really diverse bunch. You've got things like Strattera, which is an approved non-stimulant but takes a few weeks to really kick in. There's Intinuv, which can help calm hyperactivity, and you even have things like Wellbutrin, an antidepressant, or modafinil, a wakefulness agent, that are used off-label. It just goes to show you there are totally different pathways to managing these symptoms.
All right, let's move on to our second tray. Section 2 is all about nutritional support systems, fine-tuning the brain. So if the last section was the power tools, think of these as the precision hand tools in our toolbox.
The goal here is actually pretty straightforward. It's often just about correcting underlying deficiencies that might be impacting focus and behavior. Think about it. Your brain is this incredibly complex engine. And if it's missing some basic raw materials, the right vitamins, the right minerals, it's just not going to run at its best. Sometimes just fixing those deficiencies can make a huge tangible difference.
So what are we talking about here? Well, research has really zeroed in on a few key players. You've got omega-3 fatty acids, which seem to modestly help with hyperactivity and attention. Then there's iron, which is absolutely crucial since it's a building block for dopamine. A combo of magnesium and vitamin B6 has been shown to help with hyperactivity. And vitamin D deficiency is super common in ADHD, so supplementing that might help with impulsivity.
And check this out. This chart shows it perfectly. Let's talk about zinc. In one 12-week trial, the kids who got zinc supplements had a way bigger reduction in hyperactivity and impulsivity compared to the kids who just got a placebo. It's just a fantastic example of how a simple mineral can have a real impact on some really complex behaviors.
Okay, on to Section 3 from Nature's Pharmacy. This is all about taking traditional tools and putting them under the microscope. I find this category absolutely fascinating. We're talking about herbal remedies that have been used for literally centuries and are now finally getting tested with modern science.
And there are some really promising botanicals out there. You've got Bacopa monariae, a classic Ayurvedic herb. One trial found it helped reduce restlessness. There's ginkgo biloba, shown to improve attention. Panax ginseng, a controlled trial found it actually improved hyperactivity compared to a placebo. And even pine bark extract, or pycnol, might help improve concentration. It's pretty clear these plants are being seriously looked at.
And seriously, some of the findings are just remarkable. Look at this. On one side, you have saffron, just the spice. On the other, methylphenidate, Ritalin. A 6-week trial found that saffron showed similar improvements in attention and hyperactivity. The conclusion was comparable efficacy. I mean, that is just a wild finding when you put a natural spice up against a standard medication.
But, and this is a really important but, it's not all promising news in nature's pharmacy. You have got to follow the science. Take something super popular, like St. John's wort. A controlled trial found it was no better than a placebo for core ADHD symptoms. It just goes to show you that we have to be rigorous. Scientific validation is absolutely crucial to figure out what actually works and what's just, well, hype.
All right, let's get to our last section. Section 4, the cognitive frontier. This is where we're going to talk about nootropics and what's next. This is the cutting edge, the experimental tray in our toolbox. We're talking synthetic compounds, smart drugs, and all the new stuff that's shaping the future. Okay, first things first, let's define a term you hear thrown around all the time, nootropic. So what is it? Well, it's basically any substance that's claimed to improve cognitive function, things like memory, creativity, motivation. They're also known as smart drugs. It's a really broad category.
And this category includes a whole family of compounds. You've got things like the racetams, like piracetam, and its more potent cousin, phenylpiracetam. There's nupapept, which is a powerful peptide. We've already mentioned modafinil for wakefulness. A lot of these are super popular in biohacking communities for boosting focus. The hard evidence for ADHD specifically is often still developing, but they're definitely a major area of interest.
Now, this frontier also gets into some pretty controversial territory. Take nicotine. Yeah, it does acutely improve attention, which kind of supports that whole self-medication theory for why some people with ADHD smoke. But obviously, it is highly addictive and definitely not recommended as a treatment. And then you have microdosing psychedelics. A 2023 trial looking at low-dose LSD found it was actually no more effective than a placebo for ADHD. So right now, it seems the hype is way ahead of the science on that one. But it's not all just stuff from the fringes. The official pharmaceutical pipeline is super active too. There are new drugs on the horizon, like one called sintanafidine, which has already completed phase 3 trials. What's cool about it is that it's a triple reuptake inhibitor. So it's not just hitting dopamine and norepinephrine, it's also targeting serotonin, aiming for a much broader effect on both mood and focus. So as we step back and look at this whole incredible expanding toolbox, I mean, we've gone from medicine to minerals, from ancient herbs to brand new lab-created molecules. It really leaves us with a big question, doesn't it? Are we entering a new era of truly personalized cognitive enhancement? Maybe the future isn't about finding one single magic bullet. Maybe it's about finding the unique combination of tools from all these different trays that works best for each individual.